Okay.
Beautiful. So I wonder, we just have a couple of setups in here, you guys. So I want to make sure, can everyone hear me okay? Can you give me a sign that you can hear me? What do you think?
Yeah.
Okay, cool.
Mm-hmm.
Sounds awesome. So
Thumbs up.
Nice. Nice. So I'll try and speak nice and loud so you guys can hear. We have a couple of computers in the room, so that way you guys can see what's going on, but that can lead to some dicey microphone situations. So we're going to do our best to help take care of it all. So the first thing that I'm going to introduce to you guys is part of my job here in the emergency department is I work on the orthopedic team. So that means is we have patients that come in who have broken bones, and specifically here in the emergency department, in the pediatric area, we have a lot of kids that have broken arms or broken legs, all that kind of stuff. So I'm going to show you guys one of the machines that I use to help take care of these guys. So a lot of times our team consists of a orthopedic resident, we have orthopedic surgeons, we have a whole slew of people, emergency doctors, some of those types of people you'll get to meet today. But the cool thing is that we here in the emergency department get to take live x-rays of people's bones. So we have just a generic x-ray of bones that I'll show you here in a second. And I'll show you how the machine works. Okay, let's go here. I want to try to not look at myself. I want to look at the machine. How this. Now, can you see my machine? We'll find a way to do this.
Do you want me to share screen?
Nope. Let's try. Can you go to gallery view?
Yep.
And right here. Click on that one. And the dots and spotlight view.
Okay.
Okay, how about now? Can you see my screen now?
Can you guys see his screen? Okay.
Nice.
Cool.
So this is our telephorescopy machine, and the way that it works is this part right here, it's an actual x-ray. So for example, if we have someone with a broken bone, we can put their arm, so if their arm is broken, we can want to get it right. We can put their arm right here.
You want me to put my arm here?
Sure. Yeah. You put their arm right there, you press a button, and it'll take an x-ray and appear right on the screen. So if we took a picture of MJ's hand, we'd be able to see it appear right on the screen, which is pretty slow. So that's a really awesome thing. So the way that it helps us is that we are able to, this machine, see where, like, here's a picture of a broken bone. You can see right here, this is a break. We're able to take a look, and when we put a cast on someone's arm, we can help make sure the bones are in the exact right spot before we get the cast on. So it's really, really cool. So yeah, with this machine, we can take live x-rays, we can take just like picture x-rays, and this entire machine totally rotates and it spins 360 degrees to allow us for any situation, no matter what's happening, what direction the patient's in, and so that's one of the really awesome things we have here. Anyone have questions about the x-ray machine or any of the stuff that it does? And go back to here. Let's take a look.
Okay.
How about, can you see me again? Wonderful.
Yep.
So while we're waiting, we have a guest coming in at about 12:40. She's one of the child life specialists here at UW Health. So we're so lucky. We're one of just a very few hospitals in the country that has child life specialists. So, and we're one of the only hospitals in the country that has 24/7 child life coverage. So they'll tell you all about what a child life specialist is. They'll tell you about the things they do here in the emergency department, the things they do up in the hospital, and some of the education. And if you maybe want to be a child life specialist in the future, what you can do to start heading down that path. So here's one of the next things that we're going to talk about. We are going to talk about, I'm going to try and move my rolling computer over without breaking anything or knocking anything over.
Do you want to tell them about this room, John?
Yeah, that's perfect. We'll do like a 360 view here. So this room is a pediatric resuscitation room. So it's the largest room in the pediatric ER. So I'll do my best to zoom in and out and show you kind of what's going on. Maybe I'll switch to my phone. Maybe that's the answer. Okay, so now you can see, so this is the pediatric resuscitation room. So it's the biggest room in the Pediatric Emergency Department, and it also has the most equipment and most supplies to take care of some of the sickest kids in the state of Wisconsin. So we're very, very lucky to have a lot of resources here. We're very, very lucky to have some really, really incredible equipment. So some of the cool things, I'm going to turn the lights down a little bit because, oh my gosh, perfect timing. We're going to switch back to these guys, and then we'll come back and finish our conversation here. Hey guys. Beautiful. Not yet. We're just.
Hi, I'm James.
It's totally.
Hi there.
So totally don't feel. We're just gonna get using a highlight next.
Okay, how do I go back to that? Oh,
Gallery view.
gallery view. Okay.
This one right there.
Oh.
It's right here.
Oh.
Sure.
Get this going?
Oh yeah.
Okay, here we go. Hey, Julie.
How you doing?
Good.
Perfect. So while we're getting this set up, we have some of our child life specialists here today. So we are so lucky at this hospital again to have a really amazing child life program. So they're going to show you one of their favorite tools, and I'll let these guys introduce themselves.
Hi guys, so my name's Sarah. I am actually the child life intern right now. And behind me is Julie, she's the child life manager. But I have been able to work really closely with our child life team here for the past few weeks actually. And been able to kind of do a lot of the things that certified child life specialists do.
So tell me what a child life specialist does every day.
Yeah. So we have a lot of different hats that we wear throughout the hospital, but our main goal is to really help children and families cope with being at the hospital. So our goal is to really decrease their anxiety and increase their coping. And there's a lot of different ways that we do that. One of the most kind of effective ways or fun ways too is we use a lot of play in our work. So different things like providing normal activities that you might do at home, things that we can bring to the hospital. And not only does that kind of make the hospital a little bit less scary, but it also can kind of help kids stay on track with their development, which is really important, and just kind of make the hospital a more fun place. We also use play for a lot of education and diagnostic teaching. So we might use a stuffed animal or a bear and kind of practice different things that the child might experience while they're here. So, for example, kind of teaching why the poke goes in our arm, or this is how an IV is started, kind of different teaching tools that we use with play too. And kind of making sure that we use developmentally appropriate language. And so that means kind of using the knowledge that we have about what kids understand and kind of different words that we can use. So we do that. And then we do a lot of what's called procedural support. So again, kind of going in with fun distraction items to kind of be with the kids and families during some of those procedures and some of those more scary parts. We can go in and do some play and kind of give them something else to focus on and distract during the procedures. So that's a very kind of brief overview of what child life specialists do, but we have a lot of different tools in our toolbox to help with play and supporting kids and families while they're here. So one of them is our VEXA machine, and you can kind of see it back here.
All right, I'm going to switch to our mobile cam here.
Okay.
So one of my child life friends here in the emergency department said that child life specialists are like translators between doctors and kids.
Yeah.
So that's one of the ways that I think about it. They help kids understand what's happening around them. They help be like that in-between person. So like if I as a medical person said, well, your distal radius is fractured, it looks like we need to put on a cast and do this conscious sedation. Sarah might be able to take that and say,
it looks like you have a broken bone. This is what we can do to help fix it. You might get a cast, and then we might play that out on a bear too. So kind of like you said, a translator, but also kind of a teacher at the hospital too.
cool. All right,
So,
so
yeah.
this is called a
So this is our
vector.
Vecta. You can see it changes colors. It's kind of adding to that soothing environment that we can turn the lights down and it'll kind of make the room glow. And then these little guys will like come out. And they can be fun things to play with and kind of distract during different procedures or kind of just making the room a little bit more fun, a little bit more family friendly. These are great for kids of all ages, but especially useful with kids who might have some sensory needs.
Here's one of my
different
favorite
things
things
like
about
that.
it. Okay, are you ready, everyone? If you can hear it.
I can hear it. I can definitely hear that.
Super soothing.
Yep, and then you can see up here, there's a little projector so it can go on the ceiling so they have something to look at too. So yeah, this is one of our tools. We use a lot of different playthings like light spinners or other different sensory toys. Stress balls are a great one too.
We'll go back to the camera.
So yeah.
I'll show you guys one of my favorite things that we have here in the emergency department. So if you didn't know this, we all have masks on. We have to wear masks anytime we're here in the hospital. Once you can see me, I'll show you.
Wait a minute. I gotta go back to I gotta find your.
I'm up in the top left.
Yeah.
We're just working through all this technology stuff. MJ is an
Okay.
expert. I'm an expert.
No, I'm not. They know that I'm not.
Okay. So
There
if
you go.
anyone has ever blown bubbles, you have to like blow them. It's not possible with a mask on, and I've learned this because I've tried. However, we have some alternative methods. So this is one of my favorites. This is the T-Rex. When it's working, it's a bubble machine, so that way we don't have to use our breath to blow bubbles.
Yes.
And keep everyone safe. And people of all ages love bubbles, even
Yes.
adults.
Oh yeah. Child life specialists especially love bubbles too.
Mm-hmm.
So that might be something that we bring in if a patient is having a procedure or, for example, getting an IV, and during that poke part, we can play with bubbles.
Yeah, I can't even tell you guys how valuable it is having a child life specialist with this. I almost don't even want to go into a patient's room without having one of these guys with us. It's so amazing. So amazing.
Thank you.
And if anyone has any questions for Sarah or John or Julie, and we also have with us now Dr. Nick Kuehnel, who's the medical director here of the Pediatric Emergency. Yeah. So Dr. Nick can also let you know kind of where he has gone to school and what you can do. I know a lot of you have had questions of other speakers of what education that you need to receive to be able to go into any of these professions. So so Sarah and Julie and Nick and John can also talk about
Maybe we could, I
those
know
their
Julie and
profession.
Sarah have to run to their next
Okay.
engagement, so maybe if we could talk about what it takes to become a child life specialist.
Yeah.
So I'm actually in the thick of it of what it takes to become a child life specialist, but usually with child life, getting an undergraduate degree in something like child development or psychology is a good place to start. My undergraduate degree from the University of Iowa is in therapeutic recreation. So all those things kind of relate to child life. And then if you were looking to pursue a master's degree, that's something that I chose to do. Not required by our national certification group right now, but might be in the future. So my master's degree is in health and human physiology with a subtrack of child life. But in whatever route you take kind of with your bachelor's degree and your master's degree, you have to take a required 10 child life courses, and one has to be taught by a certified child life specialist. And the other ones kind of dive into child development, grief and bereavement, and kind of different subjects like that that you'll experience as a child life specialist. And once you take those 10 courses, you need to get at least 100 hours of volunteer work under a child life specialist, and then from there, highly recommended to get what's called a practicum. And a practicum is just kind of going into the hospital and observing a child life specialist. So getting at least 100 hours of that is highly recommended to do. And that is all gearing up to get an internship. And you're required to get an internship that's at least 600 hours for the accreditation group called the Association of Child Life Professionals. And so once you do all of those things and kind of get to that last step, you finish up your internship, and then you're able to apply for the certification exam. And then you pass your certification exam, and you can add a couple letters to the end of your name for CCLS.
Thank you, Sarah.
Yeah, more than what you ever thought.
More than
Yeah.
what you would think, but it sounds very overwhelming that when you're kind of all going through it, but definitely take some time, and there's steps involved. So yeah.
Cool. Anyone have any questions for Sarah from the child life perspective?
I'm watching the chat box, so you can go ahead and ask any questions in the chat box, and I will let her know.
That's awesome.
Mhm. Thank you very much,
Yeah,
Sarah.
thank you guys so much.
Yeah.
Appreciate it big time.
Yeah, thank you.
Thank
Bye.
you. Thanks so
Yeah,
much.
honestly, I think it's easier to become a doctor than it is a child life.
So now we're here with Dr. Kuehnel. He's the medical director for the Pediatric Emergency Department. So now maybe we'll hear about what it takes to become pediatric emergency doctor.
Yeah, very similar process. After you guys finish up high school, going through college, and then going on to medical school, and then depending what specialty you decide, there's lots of variations of residencies and fellowships of varying degrees. So you can, after college, get through med school in 4 years, and residency is quick as 3 years, and some, depending on different fellowship and stuff, can take up to 12 years to complete full residency and fellowship. So just to become a pediatric ER doc, I spent more time in school after high school than I did all the way through high school, just as kind of a general broad stroke. So it does take some time, but the people we get to work with and the people we get to care for every day is totally worth all the effort and time it takes. So, and it really, I kind of went the boring route and just kind of stayed straight with science and did a little bit of business stuff along the way. But a lot of my good friends and colleagues, after finishing high school, did different either mission trips for a couple of years abroad, doing things with their family, and other youth programs and church programs. I have some who majored in undergraduate and college in musical theater and ecology, and so it's not that you have to commit to one kind of area of focus at all. You just do what you like, and as long as you kind of get your prerequisites done and work hard and do some of, I would say, that extra stuff on the side that just shows that you're really committed to patient care and caring about people in general, goes a long way.
Yeah, that's awesome. Dr. Kuehnel,
And we I wanted to just interject a little bit that we have had actually, I think it's 2 or 3 previous Ready campers now who are actually residents and going through a medical education program. And also, with all your projects that you're working on, make sure you keep track of them. Like Nick had mentioned about all of the different extra things that you can do. So keep track of those projects that you're working on, and put them on your application. Whenever you're putting together an application for medical school or whatever your educational program that you decide to go into, that's very, very important to do.
Yeah, I would add even little things, that don't seem connected. As an example, going all the way back to high school, helping coach some of the youth, 5, 6, 7-year-old soccer team sort of thing. Not only including things like that you did it, but if there is even one sentence or one point that you can add to that as what you learned from it and how you can apply that to whatever your interest is, whether that's a doctor, a nurse, child life specialist, whatever it may be, there's usually some connection as to whatever kind of volunteer or work experience you have that you can connect it. And it really goes a long way, especially as you go further and further, there's going to be different either applications or essays or resumes or interviews that you have to go through, and having that kind of journal, so to say, of not only what you did, but why you like it so much and what you took away from it can really help you get those points across to people.
Mhm.
Yeah, that's awesome. Dr. Kuehnel, could you tell us about like what happens every day in the emergency department? What do you do every day?
Yeah, honestly, it's a huge team effort. You guys will learn. There is in the emergency department, things are moving pretty quickly, and there's so many different players involved that as the doctor on the team, a lot of the work that we do is really just kind of trying to man the ship. And during critical scenarios, we get a little bit more involved. But the run-of-the-mill stuff that we're doing, it's a lot about communicating with the nurses and communicating with different learners and teaching medical students, communicating with a lot of different, we have consultants, so a surgery team that comes down to help us with the patient in the emergency department, but then also with the parents and the patients themselves, realizing how to make them comfortable, like demonstrating the bubbles, things like that. And so there's, I would say probably 95% of my time is spent on not direct medical thinking, but actually a lot of the coordination, communication, and working with families and our colleagues as well.
Yeah, that's incredible. Because if I'm not mistaken, there's always learners around here. There's like always people learning from you. Is that?
Yeah. There's opportunities all along the way, from high school and college age students that are shadowing here with us, to medical students that are working. Residents is when you finish medical school, and then you're getting your specialty training and whatever it may be. Fellows is a term used for kind of the next step that are doctors, but getting even more specialized training. So there's usually, with that route, 4 or 5 different layers. And then you get on top of that, the nursing, and then they have residents and nursing students with them. And then our techs have different trainees and levels. So each kind of role of individual within the emergency department has usually 2 to 3 layers of learners underneath it that we're all trying to come together and teach each other and learn from each other.
Yeah, that's incredible. Really awesome. Can you think about one of your favorite things about being a doctor, or being a pediatric doctor?
Oh man, I mean, pediatrics specifically, it's great working with kids. It's like every night we come out of here with a different story of a thing a kid says. And the fact that you're able to like joke around and have fun every day is really a fun part of the job with pediatrics. But from a medical care, kind of the doctor side of it, honestly, just the fact that you are given the ability to have someone in their highest concern or sickest time period come in and look to you for advice, and trust you without even knowing you. I mean, that takes a lot to be able to be given that. And so I think equally the respect needs to be given back to everyone as well. That's probably the one thing that I love coming to work every day for, being able to share in those relationships with people.
Yeah, awesome. Yeah. Well, thank you so much, Dr. Kuehnel. Do you guys have any other questions?
I have one for Dr. Kuehnel and for all of you, actually. So there's a lot of chat on the chat box about community projects. So what would you suggest as some community projects that you can think of for 13 to 18-year-olds to actually work on in their community?
I think some of the easiest things are building off of connections you already have. So is it with your church group that you're involved with? Is it a different youth group? Is it with school? And from there, just kind of asking some of the people if there's anything health related. And a lot of it, honestly, at this stage from a community standpoint, probably comes down to basic first aid stuff. And so is it stocking first aid boxes at different locations? Is it teaching younger kids, the 8 to 10-year-olds, if they see someone not breathing, who you call, like simple stuff like that. Even CPR type classes. You can go take CPR type classes and first aid classes and be able to then either teach youngers or use that as a part of a learning tool within whatever groups you are. And I would say just stay curious and open, as you're going to grocery stores and coffee shops. Is there something that you are passionate about that when you look at these different locations, they're saying, hey, I didn't notice that was here. As an example, one of the, there was a family that I had cared for a while back whose daughter was only in 6th grade. And as part of their 6th grade science project was tasked with developing some sort of project. And she had noticed that the hand dryers that were in a lot of the bathrooms were right at the height of kids who are in that 7 to 10-year-old age range, and how loud they are and how that could affect their hearing. So I actually went into different locations around town, measured the height of where the hand dryers were, and then was able to get like a decibel reader essentially and record what the sound was at an adult height versus at the kid height, and show that, then go back to even companies and say, hey, we need to either affect how we change the sound, or is it something that we can adjust the height, or just be aware for parents out there that your kids are actually, just because of how they are at a much higher risk from the sound from this. So it's a really neat, like, here's an example of just like an everyday thing, just by being curious and noting, hey man, my kid's always scared every time they go in the bathroom, and I would echo mine is the same way, and covers their ears every time after I wash their hands. That is just something, you know, unless you kind of just stay curious and think about it, wouldn't come to mind. And those are ideas where you can come up with any of that. I mean, that was a 6-year-old or a sixth grader right there. So, right, even a lot of you guys are.
Yeah.
And those are all awesome ideas. A lot of the stuff that I did when I was younger was involved with my scout troop. And so in scouting, we were always working on community service projects. So finding ways to help not just us, but help other people in the community, finding ways to support the elderly people in the community, finding ways to support other learning objectives, finding ways to support the schools. But yeah, I think there's so many opportunities around. You just have to look around the community and you'll see all kinds of stuff.
Great, thank you. Does anyone else have any questions for Dr. Kuehnel? Dr. Nick?
All right, well, you got MJ's contact, so if you have any other questions that come up later on the road, she's more than able to get a hold of me. I'm happy to connect with any of you guys at any time.
Yeah.
So thanks for me joining for a short period.
We have people from various different states on too, so.
Wonderful. Yeah. Well, if you want to invite me to come out and visit, I'm happy to do that as well.
They're all saying thank you. So,
all right, thank you guys.
Yep, thank you. Thanks, Nick.
All right, you guys. So up next, we get to see a little bit more about what this pediatric resuscitation room is all about. So we are going to switch back to my mobile camera view once we get tuned in here. Once our backstage person is...
Oops, sorry. I wasn't paying attention here. All right, so I just learned something new today, so I'm so excited. Okay.
So now, like I said before, we're going to turn the lights down. Are you ready?
Yep.
So if you look, because we're so focused on trying to do everything we can
for
these pediatric patients.
Do I have the right one?
I think so. If you look up here at the ceiling, you can see there's colored lights, and this is my favorite part of the entire emergency department. There's stars in the ceiling. So you can see these stars are twinkling for patients. Because if you think about it, if you're a patient in the hospital, a fair amount of your time might be spent looking at a ceiling. So a lot of times here in the children's hospital, they're finding ways to make ceilings more interesting. So that way it's maybe a little bit better for pediatric patients. So that, yeah, all these up here, that's one of my favorite things. And now you can really see a good video of, this is from that Vector machine that Sarah was showing us and Julie. So you can see they have all kinds of stuff. Here's a little rocket ship going up. So we can project this on the ceiling, we can project it on the walls. So it's something for kids to think about. Maybe if they are getting a blood draw, or if there's something that is maybe a little bit new to them, it can probably be distracting. So it's really, really cool. All right, so we'll flip our lights back on, and we're actually going to go to the extreme now and really flip on the lights. So if you guys look around, we have all kinds of controls over here. Right now, it may be hard to see, but we have some huge examination lights. So these lights are really important because they're really, really bright. You can see on the floor just how bright these things are and how directly they're focused. And so the way that this is helpful is because when we have really sick patients come into the hospital, sometimes sometimes we really need to see what's going on, and it can be hard to see at times if maybe they need to do a procedure, or at times we have to do surgery. So that's why it's really, really helpful to have really bright lights. Okay, the next thing on our list is we have some other equipment that we use to help take care of really sick kids. So we're going to move over here. I'm going to move the Vector out of the way. There we go. So the first thing on our list, this is...
Do you want me to take that out?
This is, that's where it is. So this is our pediatric resuscitation card. Sometimes it's called a code blue card, that sort of stuff. So this machine right here, this is called the defibrillator. And the way that it works is it can look at someone's heart rhythm. So I have a machine here hooked up to that's meant to simulate a heartbeat. So if we look, so you can see on here it's beeping, and that's showing us this machine is simulating what someone's heart rate looks like. So it's really helpful because we can take a look on here, we can do other things, and we use this a lot for training. So the way that this works is we can put some pads on a patient. You can see here's a little picture of that. Especially if someone's heart maybe isn't beating, and we can use this energy in this machine to deliver a shock to them to help get their heart restarted again. So it's just like the ones you see on the wall, but it's especially for use by people who are trained in that. So this entire card is all focused on for the sickest kids, maybe the ones who aren't breathing, the ones whose hearts aren't beating, and there's medications in here, there's other stuff. It's really, really, really awesome to have everything ready to go to help our sickest patients. All right, this next card is full of all kinds of equipment. So if you take a look in here, you can see some of the things that we use. This card, the main focus is if someone needs a breathing tube. So our doctors here are very, very well trained in putting breathing tubes in, and they get a lot of experience with it. So that we have all the equipment that they need. We can see going through here. There's all different sizes of everything because we're very, very unique here at the hospital. In that we, in the emergency department, could take care of someone who is all the way from 1 month old all the way up to an adult. So having the right equipment, you can see we have equipment that's all the way, this is for like a little baby, and it goes all the way up to the size for adults. So we have to be ready for anything. So that's really, really sweet. One of the next things on our list is, this is a card that's specially designed for kids. And the way that it works is we can use a tool. It's called a length-based resuscitation tape. And so essentially what happens is we can have a kid come in who's really sick. We don't know anything about them. We can put this tape back. Oh, sorry, I think it's hard to do one hand. So the way that it works is we would have the kiddo lay here on the bed, and we can measure from their feet. We'll put their feet here. Pardon me, we'll put their head here and measure down to where their feet are. And based on how long the kid is, we can tell about how much they weigh. So 3 kilograms, 4 kilograms, and all the stuff we do is a measure. So once we figure out how long the kiddo is, it gives them a color. So we could say if a kid is about here, they're a purple color. And then we can come right over here to this purple drawer. And we know that everything inside here, all the equipment, all the tubing, all the everything is the exact right size for that kid. Because if you think about it, there's a really, really big difference between a kid who's 3 kilograms and a kid who is maybe 13 or 14 years old, you know? And so this is just one of the really, really awesome things we have here at the Pediatric Emergency Department. Does anyone have questions about any of this stuff? Anyone want to see more or hear more about any of these things? You can see there's a little bit more that we have on the walls here. We have more monitoring equipment. We have things that can look at people's heart rates and their blood pressures, machines that do all that sort of thing. If you've ever gone to the dentist and they've used the Mr. Thirsty or the little sucker for your mouth, this is that same exact thing that we can use for people. We have a way to check people's temperatures, and we have a really cool machine here that can help us look inside kids' ears. So it's a machine that was invented by one of the doctors that works here. So we can take a look and we can see exactly what's going on inside a kid's ear with this. It's like a video screen. So yeah, it's really cool that the inventor of this machine works as a doctor too. And then we have other supplies to help take care of patients, and this is an IV pump to help us give medications to patients. All right, so that's all from this video. I'm just going to switch back. I wanted to see if anyone else has questions about anything we talked about. Anyone want to hear more about any of these emergency department things or pediatric things? I know we're just switching back and forth between camera views here. Oh, perfect. So yeah, you guys got to talk to some really cool people. So we got to talk again to Sarah and Julie from the Child Life team. We got to learn about how Child Life Specialist really impacts the care that patients receive in the emergency department and elsewhere in the hospital, right? Because we We have a 24/7 child life specialist here in the emergency department, which we're so thankful for. So thankful for. And during the daytime, there are a ton of them running around upstairs. So if you come in to have surgery here in the hospital, if you are a patient who is staying here for treatment, if you're having surgery, there's a good chance that a child life specialist will be taking care of you or helping as part of your care team throughout your stay. So that was one really awesome group we got to talk to. Who else did we talk to? We talked to Dr. Kuehnel. He's really awesome. He's the medical director for the Pediatric Emergency Department. So he gets to help manage things here. He gets to help make decisions. He's part of the administration team. So we're so thankful to have him as a huge advocate for children and for our team here. Who else have we talked to today? Is that it?
And what is your role in the
Oh, that's
Pediatric
right.
Emergency
That's
Department?
right, yeah.
And what education have you taken to for your role?
Yeah, so I am a emergency department technician. We have, usually there's between 6 and 14 of them working in the emergency department at any one time. And so when I'm over in the emergency, or in the pediatric emergency department, I kind of do a little bit of everyone's job, it feels like. So sometimes I'm helping the nurses take care of patients, help get patients in the bathroom. Sometimes I'm helping the nurses to get an IV started, draw some blood, use an ultrasound machine to get an IV started. Sometimes I'm doing a little bit of what the child life specialist does. If they're busy in another room, I'll maybe hold an iPad for a kid so we can watch Peppa Pig while we're, maybe we're putting in some sutures. Sometimes I'll help doctors put on cats. Sometimes we have a ton of different roles that we have here. Just trying to see what we can do to help out. And so my background is that I am an emergency medical technician. So I went to EMT school, and we kind of talked a little bit about that history during EMS week and talking about all the different paths that we can go on to become an EMT. But it's very rewarding work here. We work with an amazing team, being here, especially at UW Hospital. It's one of the biggest hospitals in the state of Wisconsin. It's one of only 2 level 1 trauma centers for both adults and children in the state of Wisconsin. It's one of, actually, I just learned this, it's one of only 7 hospitals in the entire country that has a level 1 burn center, a level 1 adult, and a level 1 pediatric trauma center all in the same hospital. So we are so lucky to have a really amazing group of people, and that we're so lucky that so many people choose us for their care. So that's kind of my story. That's what I do here. And I'm glad you guys were able to join us today. Hopefully you got to learn some things, you got to see some cool stuff. And you want to get a Vector machine for your house or for your bedroom, that's understandable.
They're quite expensive.
I know. And so if you guys don't have anything else.
What's your favorite thing of working here in the emergency department or in EMS, either one?
So if I had to pick one of my favorite things in EMS, I think that it's so cool to be able to see people that I never would have met before. I get to talk to different people every single day. I get to interact with different people, and so it helps me get better at learning how to talk to people, learning how people have different perspectives on things. Sometimes it can be a challenge to find ways to communicate with others, and so we get to practice that every single day. We get to work with people who are scared. We get to work with people who are having sometimes the worst day of their life. But on the other side, sometimes we get to work with people who are having the best day of their life. In the ambulance, I personally have been there for the birth of 3 babies. And so though it can be stressful at times, in a lot of ways, that's the best day of people's lives. But, we're also there for the other side of things. We're there for when people pass away. So we just are so lucky that we get to care for these people and these families, and so that's one of my favorite things, being able to work with so many different kinds of people, being able to meet new people, being able to see new people. Things are always different every day. And then working here in the emergency department, I love that I can, that this organization values education so highly. So every time I turn around, there is a doctor, there's a nurse, there's a technician, there's someone from housekeeping teaching someone else how to do something. There's someone who's learning more about different things that they're interested in, who's learning more about the ways that they can advance and get better. So that's one of my favorite things. Every single day that I come to work here, I learn something new from someone around me, from one of the nurses, one of the doctors. We're always learning.
Okay. Does anyone else have a question for John? Or anyone else? We do have a nurse here in the room, but she is going to have a baby any day, so she doesn't want to be videotaped. All right. So if you have any questions about nursing also, let us know. Okay.
Yeah, I know there were a couple people who responded in the surveys and were saying, oh, you know, I might like to become a nurse or I might like to become a doctor. And so I think the theme that we've kind of been seeing here is focusing on ways that you can help others, focusing on ways that you can improve your community. And with that, being able to get those things done while you're, you know, working through middle school and high school, that will really, really prepare you well as you're moving on to the next steps in your life.
Actually, yeah. And when we have in-person Ready Camp again, we'll bring you in and show you all of this stuff personally in the emergency department. But unfortunately, we're not able to do that right now with everything being virtual. So we have to be safe, and everyone has to be safe. So, okay.
Right, thank you guys so much.
Janice says thank you for your time and the tour. So. All right. Thank you, everyone. Bye-bye.
Thank you.
You're welcome. And tomorrow, then, we're hoping to have critical care transport. So we may be with.
Could I show my preparedness kit?
Oh, yes, definitely. Hold on a minute. I have to let you share the screen. So there you go. Go ahead, Damien.
I have it. I don't have it as a picture.
Oh, okay.
I'll show on my phone.
Yeah, you can go ahead and do that. I see like a picture of the Earth or something right now. Is that?
Oh yeah. If you turn off your virtual background, sometimes that can help. I've been messed up there too, where it doesn't let me show what I want to show.
Okay. Maybe I have to do a spotlight video. Do I? There you go.
Perfect.
Perfect. Thank you, Damien.
Uh-oh, now we're backwards. Now you look like a Martian.
Yeah. You have the Earth on your face.
Oh, there we go.
There you go, Damien. Damien does TikTok videos for us.
Oh, really?
Too. Yeah.
Awesome.
I'm joining from my phone.
Okay.
Okay.
That's why.
Oh my gosh.
Do I need to change it? Oh, okay. I need to change the view to spotlight video on your phone. There you go. Okay. Oh, look at that.
Nice work. That looks awesome.
We don't have our radio or maps yet.
Oh, okay. Can you explain all the pieces of your emergency kit, Damien?
We have some board games, treats for my dog, and food for her somewhere in here. Change of clothes for my mom and I. 2 blankets. 2 mess kits. Some matches. Some Clorox wipes. Basically the basics.
Awesome.
My first aid kit.
Your first aid kit? Cool.
Hygiene. Pocket knife and an SOS kit.
Excellent.
And
Love
flashlight.
it. Way to go, Damien.
Thank you.
Yeah, it looked awesome.
Yeah, that is great. Thank you for sharing with us.
You're welcome.
Does anyone else have anything you want to share today? Okay. So tomorrow then, we're going to talk about critical care transport. Okay, so we're not sure if the helicopter will be available or if we will be talking with the ground transport team, but we will definitely be doing something with ground transport, okay? If nothing else, we will, if everyone is on calls taking care of patients, then I will put together some pictures from previous Ready camps that we can share, okay?
Sounds good.
All right, we'll talk to you tomorrow. Thank you,
Thank you so
everyone.
much. Bye.
Thank you, bye-bye.
Thank you.
Thank you, everyone, bye-bye.